Here is your question. Right. So if you have read and understood, considering the surgical pathology station, kindly tell me what are the differential diagnoses that you will consider for this particular patient?
My differential diagnosis are tuberculosis of lung,
Okay.
lung carcinoma,
Yes.
lymphoma.
Okay. Good. How would you confirm your diagnosis? What investigations would you ask for?
I would ask for sputum cytology, sputum
Yes.
culture,
Yes.
Manto test, TB PCR,
Yes.
TB quantiferon test, and
Okay.
FNAC,
Yes. Of the lymph node.
and high-risk HRCT of chest.
Yes. Okay. And simple sputum test. Manto test.
Okay.
Okay. Can you please tell me if you, because you said you'll be asking for FNAC, and if you do the FNAC and you do the biopsy or histology, what features would you see in a histologic yeah.
There will be necrotic tissue,
Okay.
histiocytes,
Yes.
and giant cells.
Okay. Germ cells or Langerhans cells. What type of granuloma would there be?
This is caseating granuloma.
Okay. If you'll do the histology, then I want you to describe the structure that you'll see under the microscope.
We will be seeing granuloma,
Okay, or the granulation zone, and then
granulation zone, and
what would be in the resorption zone? There'll be three type of zones you will be seeing, like first resorption zone, then granulation zone, and then mature connective tissue zone.
okay.
Yeah, and foam cells among fat cells and lysosomes, vacuoles, they'll be present in the resorption zone, whereas the granulation tissue and other capillaries and these will be in granulation. Okay, you can read that later. Right, okay. If you can tell me, you told me already that there'll be, okay, granuloma and caseating kind of. Can you name few conditions in which granuloma can also be found?
Yes, ma'am. It can be infective or inflammatory.
Yes.
Infective can be tuberculosis, leprosy, fungal infections.
Yes, or
inflammatory can be rheumatoid, Crohn's disease, sarcoidosis.
Very good. And there could even be present in case of foreign body.
Yes, in foreign body also.
Like once there is suture left for a long time, or there could even be seen in case of malignancy like Hodgkin's disease. Okay, can you describe or tell me if you have to figure out what is the rapid detection test for Mycobacterium?
It is TB PCR, polymerase chain reaction.
RPA, recombinase polymerase amplification. Okay, that is done. Right. You've already told me you'll do FNAC. Okay, how long or how long can you take the culture for tuberculosis?
Around 6 weeks.
Yes. Okay, can you tell me what is the proteinaceous substance that is found in tuberculosis patients?
AA amyloid.
Okay, can you also tell me, once you have collected the sputum sample, how would you collect it and how would you transport it?
I will transport it is in a biohazard bag
Yes,
and label it as category B,
yes.
UN 3373.
Okay, very good. Can you name few other mycobacteriums that are present? Not necessarily in humans, but they are present.
Mycobacterium leprae,
Yes,
Mycobacterium avium complex,
yes,
Mycobacterium bovis.
very good. What is mycobacterium, if I ask you?
Mycobacterium is a gram-positive bacilli,
Yes,
which is also acid-fast positive, and it is a slow-growing organism,
yes, very good.
and it
It's aerobic as well, and
it
it's
is
broad.
yes, yes,
Okay,
broad.
once the sputum specimen is collected, how should it ideally be labeled?
It's labeled as biohazard category B1
Category B.
3373.
Yes. Okay. Yes. When you are collecting the mycobacterium, what is the culture media which is used?
It can be solid media, which is lower stringency media, or
Yes.
liquid media, which is Bactec media.
Okay. Can you please tell me why having tuberculosis can be considered as a public health threat?
Tuberculosis can spread by a droplet infection,
Very good. Yes.
and it can spread easily and can and its treatment is difficult compared to
Yes.
other
Right.
diseases.
And okay, there are certain, one is it's communicable disease, and then
Okay.
okay, isolation and all right. Okay, you'll read that. Can you tell me how the contact can be stopped or prevented or can be taken care of?
Yes, all persons who comes in contact with the patient
Yes.
should be traced, and they should be counseled and screened, and if needed, should be treated for tuberculosis.
What should be the ideal treatment for tuberculosis?
Uh,
Tuberculosis lung.
it's a directly observed treatment short course.
Yes.
Depending upon the category, we have to start on uh, antibiotics, mainly isoniazid,
Yes. There are
rifampicin,
something. Yes.
ethambutol, and
For how long?
pyrazinamide
Yes.
for first 2 months, and then in the continuation phase, it is isoniazid and rifampicin alone for next 4 months.
Very good. If patient does not respond to the medications, tuberculosis medications that you're giving, what measures can you take? What should you do?
We have to evaluate the patient for multi-drug resistant tuberculosis,
Yes.
and his drug sensitivity should be checked via culture,
Yes.
and he should be started on with second line anti-TB medication.
Very good. Okay. Right. When would you declare the patient free of tuberculosis?
Mm, when I don't know
You know the
compared to
answer. Think.
sterile.
All the tests that you
When
did.
the sputum culture, yes,
Yes.
sputum
Yes. There'll
sputum
be,
AFP is
and
0
patient will be symptom free, and all the tests will be negative.
when patient will be symptom.
Yes. So you know it. Very good.
Okay, ma'am.
Excellent. All right. We'll move on. Can you help me describe this image? First of all, what do you see?
This is a histology slide
Yes.
with hematoxylin eosin stain
Which stain
showing
do we use for tuberculosis?
seal Nielsen stain.
Zilnitson. Okay, very good. What do you see? Can you describe anything that you see?
This is
What
there
are
is central.
these? Yes.
This these are lymphocytes.
Okay. But they're stained and
Yes, and there is
proliferated.
central
Yes.
is proliferated, and there are giant cells in the center.
Yes. Very good. That's what you have to describe. Very good. And if you can, before we go, can you help me read this X-ray, please?
This is a chest X-ray, PA view
Yes.
with
Very good.
adequate exposure,
Yes.
showing bilateral hilar shadows,
Yes. And
and there is a consolidation on the left upper lobe, towards upper lobe,
yes.
and multiple patchy opacities along the lung shadows
Very
bilaterally.
good. Which might be suggesting of tuberculosis infection or very good. And it's a male patient's X-ray. So
Okay.
very good. Okay, this we can see. Good. Thank you.
Thank you.